I'm James Sutton. This is Road to Recovery. My guest today is Arnecia Moody. Welcome, Arnecia.
Yes, hello. Thank you for having me.
So you're kind of new on the scene. I know who you are because I see you at events in the community. Can you tell us a little about what your position is and what you do for Montgomery County Health and Human Services?
So I am the Senior Administrator for Montgomery County Health and Human Services under the Behavioral Health and Crisis Division. I am a manager too for them.
Okay.
And
go ahead.
And the different program areas under me are the MAT program, the Medication Assisted Treatment program. We have a clinic. Also drug court, we have a DUI court. We also have our jazz program, which you are a part of, which
Yes.
I'm very happy. Our jail-based addiction program, jail-based addiction services. We have our CATS program, that is our clinical assessment team and transitioning team. And we have our behavioral health clinics. We have our adult behavioral health clinic. We have a child and adolescent behavioral health clinic. We have 2 clinics, 2 sites, 1 clinic.
Wow, that's a lot.
Yes, yes, yes.
And so how did you get into this field and how did you get over here to Montgomery County? We're glad to have you.
Yes, I'm glad to be here. That's a very interesting story. So I started out in New York City working for the child welfare foster care system. I worked there when I was fresh out of college. I thought it was the best job in the world, and I thought I would never leave that position. So I really enjoyed that. I did foster care services.
Oh, okay.
I moved here from New York City. It was New York is New York, so I don't think I need to say anything more.
No.
But I moved down here and I started working for child welfare. I didn't want to get away from social services. I have a passion for working with social services. When I came down here, I worked at child welfare. Then I transitioned to the school system where I was the director of school social work. I worked there for a period of time, but I missed human services, so I decided to go back. And I ended up in Virginia at a few different behavioral health agencies, and then I ended up here. And I'm happy to be here.
And we're happy to have you.
Well, thank you.
And because this is National Recovery Month, you know, it's not by accident that it ends up, you're my spokesman for National Recovery Month here on our show. Because I see you in the community at all the community events, and I'm saying, like, this lady is a manager. You know, they work so hard. I thought they just, you know, rest on the weekends, but you're right, boots on the ground. Every place I go, I see you at all the events.
I really enjoy that. I enjoy being a part of the community and getting to know the community. I also think it's important for me to get to know the people of the community and the people that we provide services to. So I try to come out myself a lot just to be a part of that and to be able to talk to people, get to know people, and understand some of the issues that are going on in our community. And I actually really enjoy getting out and doing things like that.
Right, and we're glad to have you because it's important that the people who make policy and have the ability to make system adaptations understand, you know, where the gaps are from our standpoint. The clinician in the community that actually are with the people, seeing and feeling, you know, their sadness and their grief and their, you know, trauma.
Yes, yes.
Sometimes when you get into management, you kind of get away from that because you know, doing management.
Yes, I try to keep 1 foot in each though. So I work part-time, sometimes doing private therapy just so I can stay connected to what it's like to be a therapist and to work with individuals and just to have an understanding of what's going on in the community and working with people and working through things. It helps me to better understand the people that I work with. Shout out to all of my teams. Thank you for all the hard work that you do. I appreciate it always. It just helps me to understand, and it helps me to relate to the things that they're talking to me about. I welcome feedback. I really like when they, you know, come to me, they offer their honest opinion about things, because I think working together, we can make a really good system for individuals in our community.
Right, and you know, I really appreciate that from a manager, because, you know, I don't see that in all, treatment centers and all, agencies, sometimes management can be not modeling the behavior that you're describing. They can be very business-minded and successful at business, but get away from the human element. So sometimes the clients are not really getting, the services that they really need, and there's not being the kind of changes. Like after COVID, we have so many, people who had knowledge that left. We really need a good management role model to lead the way for the new people coming in.
Yes, I hope I'm able to do that. I hope I'm able to do that. I just really feel like it's so important for people to be able to see the humanity in me and for me to be able to see the humanity in them.
Right.
And just to work together, right?
Right. Well, I think you're doing a great job. You're setting a really good model for other managers and, of course, for, the line clinicians and therapists that you have so many people that are working under you in so many different, departments that I guess it's really like, because of your diverse background, you're able to understand the child and adolescent, the addiction. This is the first time you had the jail part, though, right?
I've worked with forensic programs before. Okay. Yes.
Okay.
At my former job, I did so.
Okay.
Yes.
Okay, because some people can't handle the forensic part.
I really like that. I like to visit the programs at doors. I appreciate that at the Department of Corrections. I try to go once a month just to see the good work that you guys are doing, and I appreciate all the good work that you guys are doing. I don't want it to be that I'm not able to go and be with people and do the same things that they do, the people that work under me. So I want to be able to understand everything. I want to be able to support the staff as much as I can. Well,
that's good. I'm glad you because our partnership with DOCR is so important. I mean, I know where I work, I've been at Jazz for 13 years, and we've been a guest of DOCR. We've been able to provide services in the jail for quite some time. I think it's like 20-some years. I've been there 13, and we've had a really good relationship at all three facilities. I do a group at PRC. We got the jazz program at MCCF, and then CATS at MCDC. So, we have really benefited, and the community, Montgomery County community, has benefited because of our relationship, our partnership with that particular, agency.
Yes. I would like to give a shout out to our chief too, because she's come to visit our programs, and she really believes in being a part and seeing the things that we're doing. So I appreciate that. So she visited the programs at the jail, all three of them. So I just wanted to give a shout out to her, Monica Martin. That's our chief.
And Monica, I think I was there when you brought her in for the tour.
Yes.
Yes, she's really been assertive. She's really looked like she's really getting involved in, learning the different systems and the players and really getting things done. She seems like she's no nonsense.
Yes. I appreciate her very much. I appreciate her leadership, and I appreciate her for supporting our program. So, and then coming to see them. So that meant a lot to us, just to have her come.
Right. And so hopefully I'll have her on the show one day. So she can, tell us a little bit about her and how she got in her position,
Yes. I'm sure she would like to come.
Yeah, because I had Raymond, when Raymond was chief, he came on our show and talked a little bit about his position and why he does what he does. So Monica, she definitely would be welcome to come and do a show with us.
Yes, that would be wonderful. I actually met Raymond, so.
Oh, you did?
Yes, I had the opportunity to meet him. He's wonderful.
Yeah, he was very supportive of Tree of Hope, and you've been really supporting Tree of Hope since you've been here. So now we have a community center, and that has a lot to do with your leadership and the leadership in HHS right now. And now we got the youth program, and that's because of you guys. We have the clubhouse that we've just opened up, and all that's because of your backing.
Yes. We believe very deeply in peer support services.
Right.
I think it's really helped us to, I wouldn't say that we're out of the crisis, but to make some leeways in the crisis, the addiction crisis.
Right. And the Crisis Center, too, you've hired a lot of peers at the Crisis Center.
Oh, well, I didn't. It would be my counterpart, Darnay.
Oh, so, Darnay, yeah.
Yes,
Darnay,
yes,
she does a great job.
Yes,
you have to give
does.
a shout out to Darnay, too.
Yes. Yes.
So, what is some of the things that you've noticed that we can do better? Have you noticed any areas where maybe because of COVID or, short staffing, is any area that you see that you want to work on that we could do better in Montgomery County?
I don't like to say necessarily to do better, but I think that we can improve, right?
Okay.
The system that we're under. I don't want to say that we're not doing a good job. I think that we have really good services, but just to enhance and, grow our services, I think that's very important. I also think it's important to pay some attention to our forensic services to make sure that the people in the community are getting their needs met. I recognize that we have some gaps, right, in services,
right,
and we have areas in the community that need more support, and just to be able to do that as we expand. I was telling someone today that I really like it here, and I love the work that I do, so I intend on being here for a while.
Good.
So just for us to be able to expand, reach more people, and provide more services to people.
Good.
Yeah. Things are really hard right now, so just to be able to be the safety net that we've always been.
Right. I know that because you talk about your passion for working with the youth, and we were talking a little bit off camera about how we need more services for youth. I know that in Montgomery County we are lacking in some of the supports that would be good for our youth, because we have, even though we got the clubhouse in Tree of Hope now, we still have a lot of drug use with the fentanyl in the school systems. That's why we're really glad we got peers now, youth peers going into schools. But do you see any areas that we could really benefit from with the youth?
I think that if we could go more into schools and provide services and collaborate with them more, that would be very helpful to us.
Okay.
Just to be able to meet people where they are. I think that we need more services geared towards young people. We have our prevention services, and we've built those up, right, for our team. And, we're really proud about the work we've done around that. But we also need to enhance as much as we can the services that we're providing for people that are struggling, and some of our adolescents are struggling.
Right.
And some of our middle school students are struggling. So
yeah. And we have to give a shout out to, now Ben is officially,
yes.
What's his position?
He's a manager 3. Shout out to Ben Stevenson, the second. He always says the second.
The second, because we have 2 Ben Stevensons, right?
Yes, and he's been able to build up his prevention team and harm reduction, and they've done a lot of good work, and they've done a lot of good work with the Tree of Hope also. So.
Right, I always see him at events too. As a matter of fact, even though he's a manager, I always see Ben carrying the boxes and stuff. I said, Ben, you're the heavy lifter.
Yes.
So he's boots on the ground.
Yes, he is.
Yeah.
He works very hard too.
He does. So we're coming to a little break now. Okay. So we're going to take a commercial break, and then we'll be right back, and we can pick it up. You can tell us what the future looks like.
Oh, I'll be excited to do that. Thank you.
So this is Road to Recovery. My guest today, Arnecia Moody, and we'll be right back.
Substance use disorder and addiction is so isolating. And so, as a Black woman in recovery, hope must be loud. The moment I chose hope was when I couldn't look myself in the mirror anymore. I did not recognize myself. Absolutely. So I'm so proud because I did not think I was gonna make it. And now, I get to call my mom and say I love her. I get to teach my son how to say, Mama, I love you. Yeah. So So for me, hope in this moment, it is the thread that lets you know that no matter what happens, you will be okay.
Judy.
Hi, I'm James Sutton. We're back with Road to Recovery. My guest today, Arnecia Moody. All right, Arnecia, we were just talking about your passion with working with youth, and we gave Ben a shout out about his finally getting he was doing the work. Now he's officially has the position, so I'm so happy for him because he does such good work.
Yes, and he has staff now, so that's really good.
Oh,
he has additional staff.
He has additional staff, so
Yes.
that's important too. Because prevention is so important and it's neglected a lot. A lot of times, you know, the counties don't want to spend money on, you know, the prevention. They just want to put a Band-Aid on the problem because the problem is presenting itself. The people are, you know, hurting, and all the money goes to that instead of the prevention. So prevention gets neglected a lot across the country. So I'm glad we got Ben in that position.
I agree.
So what else do you have a passion on that you wanted to talk about?
Well, I have several passions, but some that I really like to put forth in the work that I do is removing the stigma associated with substance use disorder and with mental health disorders.
Oh, okay.
So I really try to work really hard to make sure we're using person-first language, to make sure that we're honoring the person and putting the person before the disorder or the problem issue.
Right. And that's the reason why we created this show. As a matter of fact, Melissa, the station manager, I need to give her a shout out because when I approached this station and said, you know, I thought I was going to get pushback. I said, like, I'm a person in long-term recovery and I want to do a show about addiction and recovery. She said, great, let's do it, right?
That's wonderful.
Just go and, you know, come up with a syllabus and, you know, we can do it, right? So the station was very supportive, you know, and we've been running with it because what we want to do is let the public know that addiction is a disease that can be treated, we can recover. It's not a moral problem, it's a medical problem. And there's a medical, you know, treatment rather than incarceration, right? So we want the public to get away from thinking that a person that drinks or uses substances should be locked up. Because they don't get better in jail. They get better in treatment.
It gets worse actually when they're incarcerated, right?
Okay.
Because we're removing them from their family. We're hurting a whole family system.
Okay.
So we really want to make sure that we're getting people the help that they need. And we also always want to make sure that we do least restrictive, right? And get people the help, not lock people up. So that's very important. I also like to raise awareness about mental health disorders and about suicide, addiction issues.
Oh, okay. So I know that I've seen that you guys have been really posting a lot about mental health and suicide awareness.
Yes.
You do a lot of work letting us know about trainings and opportunities to learn more about you know, suicide in specific areas, like in the Black community, suicide in general, suicide in different populations. You've been doing a great job, you know, informing us about that.
Well, thank you. In my former job, I was the crisis manager. So
okay.
So that's a special area for me too, and I want to make sure that we're recognizing that we have a lot of people and a lot of adolescents that are completing suicides or dying by suicide. So just to raise the awareness around that. And a lot of elderly people who are suicidal. So.
Okay, and that's a neglected population too.
Yes. Maybe we come back and talk about that. We can have a whole conversation, a 30-minute conversation about that, because we really have to do more for our seniors. Like we have two populations, right, that are really fragile. We have our young people that we always need to pay special attention to, right? Because they're our future. And then we have our elderly population, our older population, I'll say, that have worked and that have been able to bring our country forward and support people, right? So they should have some grace and some dignity, and we should pay attention to them, right? And take care of them the way they took care of us.
Yeah, that's a good point. And they are neglected. A lot of times their families have moved on and they're alone. There's a lot of, and there's actually uptick in drug use because some of them are on medications that are addictive, and being alone, sometimes they can. When I do my Narcan trainings, I always include that the elderly can accidentally overdose, so you need to know how to do Narcan just for your relatives who may accidentally take too many of their medicines, and overdose. So everybody should know how to use Narcan, right?
Yes, I know how to use Narcan. Yes. I've actually used it before.
Oh, you have? Oh,
yes,
wow.
In my former job. So, just to go back to what you were saying about older citizens too, we have a lot of people that are lonely now, so we have an epidemic of loneliness, right? So it's good if people, be mindful that we have to give a little extra care and support to that population.
Right, that's a good point. I'm glad you brought that out. Now, in the future, I know I was on a meeting. I'm a part of the group for the Diversion Center, and that's like such a good addition to Montgomery County that I don't think the public knows about yet. Even though, have we had an open forum yet? I think we're going to have an open forum this month, or it's up and coming.
It's up and coming, and we've had some stuff posted online. So in the past, we've had it on our Montgomery County website. Our diversion center is going to be, it's 2 sites. It's 1 location in 2 different sites, and it's really intended to address the needs of people who are using the emergency room for treatment, for mental health treatment and substance use treatment, and just to divert people away from incarceration. So people who would benefit from being dropped off at our center to get some mental health treatment by the police. So it's for law enforcement, where they can drop a person off to us if they're incarcerated, and they can release them to us.
Okay. So it sounds like that's going to be less of a burden on the criminal justice system, because people with the little misdemeanors, because, in my experience, a lot of the people, when they're not taking their medication with severe mental health, they might go into 7-Eleven and take some food, or they might sleep in a car. And those kind of charges, they don't really need to be in with someone who committed murder. They just need to take their medicine. They need some care. Not isolation. That may re-traumatize them because they haven't been on their meds or been sleeping on the street or whatever. You know what I mean?
Yeah.
So they need care.
Yes.
More so than incarceration. So it sounds like this is going to be the model.
Well, this will be a game changer for us, right? Because we can better take care of the needs of our population out of a carceral system, and we can take care of them. One site is going to be at Picard, and then the other site is going to be at Seven Locks, right? So we would better be able to meet the needs of those individuals needing immediate care, right? And people don't have to board in the ED. Okay. So that would be great.
So that's going to save Montgomery. So this is important. That's going to save Montgomery County a lot of money, right? Because
I hope so, but it'll save lives too, right?
Well, both. It's a win-win.
Yes,
I mean, if you get people, because the emergency room is the most expensive medical care, right?
Yes, it is.
So, and I know from doing work in this county for 20 years, I know that I see the same people at the shelter, at the emergency room, in the jail, and Avery Road. It might be the same, 150 people mainly, right? So if we can get them treated, that's going to save Montgomery County a lot of money.
Yes.
Because, that population needs help. They need treatment.
And then the longer you go without treatment, the harder it gets to be able to treat you and stabilize you, right? Right. So mental health left untreated gets progressively worse. So that's why we really want to be able to work with people and get them the help that they need. Right.
And something else I like about Montgomery County, I was on the advisory board, the Alcohol and Other Drug Advisory Board for 2 terms, right? And I was like representing people in recovery, right? And I really appreciate the fact that, you include people with lived experience, and you include us in the conversation about what's getting ready to happen, and we can actually affect policy, right?
Yes, yes.
And in the Diversion Center, there's representatives from the community and different, you know, interests in the community, so that this new place that you're developing is going to be state of the art, and it's going to have some new dimensions based on what the population say they like. Because I was like, they're even going to have the tiles in the floor and the colors that people with severe mental health will respond to positively rather than causing a trauma.
Yes, yes, yes. I have a specialization in trauma.
Oh, you do?
I do.
So
I really enjoy that. I think it's important for us, right, that we include our community. That's one thing I really, really love about Montgomery County, that we work with our stakeholders, we work with our community, and we give a lot of thought and a lot of consideration in the things that we put forth for the community. So I really appreciate that.
Yeah, you know, my particular approach is the Ross approach, you know, that we, you know, that recovery happens after you leave the treatment center and happens in the community, that people get well in the community. And it's a community effort. It's not just the therapist that cures a person. The whole community helps the person get better over time, right?
Yes, it takes a village.
It takes a village, yes. So, you know, the religious and social groups, you know, all the different elements in the community, you know, have to embrace the person coming home from incarceration or leaving a treatment center, and help them reintegrate, you know, provide services, you know, and support.
And grace.
Yeah, and grace.
Yes,
and compassion.
Yes, yes.
So this is like you know, my approach to, you know, the helping field.
I like your approach, James. I like your approach a lot.
And it's actually SAMHSA's approach.
Yeah.
Recovery-oriented systems of care, right?
Yes.
So I've been pushing that for a long time, right? Since I learned about it, right?
Yes, I love that. Because you are a part of your community, right?
Yeah.
And the different systems that you interact with, so that's really good.
And you know, Tree of Hope, this is what we do. We want to be community organizers. You know, we want to connect with, you know, even though it was a particular pathway that I used, you know, in my recovery, you know, was a 12-step, you know, fellowship, but I want to embrace and connect with the whole recovery ecology, the whole landscape. So whether you're Smart Recovery, whether you're the church or Islam, we all have you know, we're all in the same community, so we should work together.
That's my philosophy in the work that I do. We need to work together. We're stronger together, and when we work as a community. That's my superpower. I like to collaborate with other agencies.
Right.
And just to work together to be able to meet the needs of the community. So.
Right. Well, that's why you're doing such a good job. I like your approach, and it seems to be working.
Well, thank you. I won't attribute it to me. I'll attribute it to my people. Because I have really, really good staff. So I'm very thankful for the people that I work with. So.
Well, I'm sure they appreciate you. And so we're coming toward the end of the show. Is there anything that we didn't talk about that you want to mention in closing? We talked about the Diversion Center. Is there anything that we didn't talk about that is on the radar? Or that you didn't get an opportunity to talk about?
Just that I want to continue to get out and know the community and get to know the different players and the different stakeholders in the community. I've been able to work with some wonderful partners, Tree of Hope, the school system, and different partners. So just to continue that work and to continue to work with individuals and groups in this community.
Well, thank you. We're not going to let you leave.
I'm not going anywhere. I actually
good.
love it here. I do. I really do. I think I found the place for me when I interviewed for the position. I said, oh, this is all of my experience rolled up into one.
Yeah, you seem perfect. You know, you know, we really need a person that has, you know, a diverse background. So they understand more than one, you know, population's needs.
I like that. I like that it's a different thing that you do, and it's different services. So.
Right.
Yes.
So we'll have you back to talk about some of the other things that you're interested, like the seniors, right?
I'm going to hold you to that. Yes, I am.
Okay. So thank you again, This is James Sutton, my guest today, Arnecia Moody, and we'll see you on the road to recovery.
Thank you.